Hello, everyone. Welcome to our facial rejuvenation webinar. I'm Ashley, one of the nurses here, and I'm here with Amanda. We are going to be educating you guys on Sculptra and Dysport. Thanks so much for coming. So Sculptra is an injectable biostimulator. And what that means is we inject it into the face to help our body produce collagen and elastin. And collagen and elastin are things that we lose as we age that helps to give us that supple volume and give us kind of more of that baby face. So by injecting the Sculptra, that can help to slow down the aging process, I guess you could say. With fillers are more for giving that kind of instant gratification, like in through the cheeks, the chin area, the lips. It's not necessarily stimulating collagen production, so that's where the two kind of go hand in hand. So with Sculptra, ideally anybody is a good candidate. I mean, even at the age of 20, we start to lose our collagen about 1% per year. So starting at an early age will help to prevent the aging process. Truly anybody that's noticing the aging process happening in their face could benefit from Sculptra. Anyone who is going through a weight loss journey and starting to notice things kind of sagging and falling, or they're losing a lot of the fatty tissue in their face, Sculptra is a really great option for them. So with Sculptra, you start to kind of see the results at around 3 months after your treatment. You'll start to notice a little bit more kind of suppleness to the face, especially when washing your face or putting skincare products on. Usually around 6 months is when you'll see the full benefit from your treatment. However, with their case studies, we have found that we continue to see further collagen production up till 2 years after your treatment. So with Sculptra, it is an injectable treatment, so you will feel the pokes a little bit. We do have a topical numbing agent that we can use to help with that discomfort. However, the pokes are very minimal. It feels similar to having filler or even your neurotoxin injection. Patients tolerate it really well, and it takes about 20 minutes at the most. So I feel like patients can get through the treatment easily. I love that Sculptra can be customized for each patient's goals. For our younger patients, if they're just hoping to kind of slow down or prevent that aging process, they might just need 1 or 2 treatments to help prevent that aging process, as opposed to somebody that's in their older years. If they're looking for more of that volume restoration and kind of lift and support to their skin, then we can customize by doing multiple treatments on different areas of the face to give them the most benefit. So with Sculptra, there's not a lot that you need to do to prepare for your treatment. The biggest things to take into consideration is to make sure that you stop taking any sort of blood thinning medications about 2 weeks prior to your treatment. Of course, if you take any medications that are prescribed by a doctor, you'd want to consult with your doctor prior to that. Also, any herbal supplements that you may be taking, such as fish oil, ginkgo biloba, vitamin E, things like that, that can thin the blood, you would want to stop taking prior as well. But really, other than that, it should be a pretty straightforward treatment. Collagen stimulation, I feel like, is a word that gets
thrown around in aesthetics, and people don't always understand what that means specifically. With Sculptra, collagen stimulation is very literal and very different from filler. How it's stimulating collagen is Sculptra particles act as a controlled irritant. And when it's injected, our body recognizes that as foreign material. So the fibroblasts will stimulate type 1 collagen around those Sculptra particles. And after like weeks, months after the injections, eventually that just then dissolves. And what's left is your new collagen framework. Typically, 3 to 6 months following the treatment, the new volume that a patient sees is not Sculptra, it's your new collagen. So Sculptra is injected in the temples, mid-face, nasolabial folds, jawline is pretty standard. So typically, a good rule of thumb, we like to say 1 vial per age of decade of life. So if I'm treating a 40-year-old patient, 4 vials is typical, and we break that up into 2 vials per setting that are spaced out about 4 to 6 weeks apart. So the downtime with Sculptra is pretty minimal. I tell a patient to anticipate swelling, redness, tenderness, and anytime we're doing any type of treatment that is done with a needle, bruising risk will always be there. So that's hit or miss. We like to tell patients we have a rule of 5 following the injections. So I want them to massage the treated areas 5 minutes, 5 times a day for 5 days. So the consultation is pretty straightforward. I think it's just really assessing the patient and figuring out if this treatment is what's best suited for their goals and needs. If a patient has a lot of volume deficit and they're wanting kind of an immediate result, Sculptra is just not the answer. So it's just really trying to meet their goals. And as far as them having the treatment done the same day, certainly can do so. Rather, it's just if they have an upcoming event, the swelling, the bruising, those types of things will interfere with that. But if they don't mind, or if there's nothing upcoming, then we can certainly proceed with treatment that day. So with Sculptra, maintenance is pretty low after they've received all of their treatments or all of their vials. I'd like to have patients after 2 years having had the treatment come back and start maintaining with 1 vial per year.
And I'm here with my patient, Dawn. She is a 62-year-old who is looking for different options to help kind of restore some of her lost volume and give more of a youthful appearance. So we are going to be treating her temple region and through here to restore some of the lost volume that she's had over the years, as well as down in through this space below her cheekbone. We call it the preauricular space. This will help give some support and help to lift and help to improve some of her smile lines that she has in through here. And then we also plan on treating her nasolabial folds, as well as some of the chin shadowing here, just to give a nice little boost and overall youthful glow. So let's get started.
Hi, it's Ashley from the Bengtson Center. I'm here today with my patient, Tracy. She's 41 and was looking for a good preventative treatment just for aging. So she's looking to treat some of her fine lines and wrinkles and then just restore some volume loss that she's had with aging. But looking for something that's going to require no downtime and also something that will be preventative moving forward.
Thank you for joining us for our Sculptra webinar. Be sure to stay tuned for our live Q&A after this. Hi everyone, I'm Amanda, the aesthetic expert here at Symmetry Med Spa. Thank you for joining us to learn more about Sculptra.
And I'm Ashley. I'm also an aesthetic expert here. We're excited about the Q&A kickoff, and feel free to start asking questions.
And while we're waiting for the questions to come in, everybody that has attended the webinar this evening is going to be taking advantage of some of our exclusive event specials. So those specials, the biggest one that we have is if you purchase 3 vials of Sculptra, you will receive 1 full syringe of Restylane filler free. So you also get to enjoy an additional $150 off instant Aspire rebate savings. So it's a really great special that you can take advantage of. We also, if you're looking for just filler, we do have a special for $100 off a full syringe of filler and $50 off a half of a syringe. So we'll jump into the questions here. The first question that we have says, does getting Sculptra make it more difficult to get a facelift if deciding to do that in the future, and does filler? So when it comes to Sculptra, I do typically recommend that if it's something that you're planning on getting if you're planning on getting a facelift in the near future, it is recommended to wait on getting Sculptra. If you're thinking like 5 years down the road, that would be completely fine. But within the next year or 2 years, it can make it a little bit more difficult to have a facelift done. It can be done. It just might make it a little bit more difficult on the surgeon. With filler doesn't necessarily cause any increased difficulty or anything with a facelift. Sometimes the surgeons might like filler to be dissolved prior to having a facelift, but usually it's completely fine with filler.
And the next question, how many vials do I need of Sculptra for mid-face facial balancing? So typically 4 vials is pretty common, but we do say like 1 vial per age of decade. So if somebody's more in the 60 range, like 6 vials would be typical for that patient. And we like to space those out just with 2 vials per setting.
Yep, and the next question, how often should I get a maintenance of Sculptra? So typically, like she said, we like to start with the series of injections, a vial per decade of your age. And then after that series is complete, the next year or potentially the next maybe 2 years, we like for you to have, like we call it like a birthday vial, where you have 1 vial per year just as a maintenance.
Yeah, I agree. And can I do Dysport on the same day? Yes, absolutely. If you're here and ready for the pokes, we can certainly do both.
The next question, to address nasolabial folds or mid-face laxity, do you suggest Sculptra in the cheeks and temples or directly in the folds? So typically when we're talking about having the concerns right in the nasolabial folds, we first want to look at the patient's volume in their mid-face. If they have had some volume depletion and some descent of this area, then we know we want to kind of restore that volume first, because that can help to kind of take the pressure off of the nasolabial fold area. After that's performed, then that's when we go back and reassess and see, okay, would we like to place some filler in through here, or would Sculptra potentially be a good option? It's something that we would have to kind of take a look at the time.
Yeah. And kind of to piggyback on that, if a patient is wanting to address their temples, if they have a lot of deficit, I think a lot of us here like to almost address that area with both. The temples can be a risky area, so sometimes treating with filler and then kind of back to hairline, I like to do Sculptra as a safer option. Can you talk more about the 5-5-5 rule? Yeah, super simple. That's how we want patients to, I guess, take care of themselves after having injection. So we want them to massage the treated areas. So for treating temple, mid-face, kind of just give, a nice massage through the area for 5 minutes, 5 times a day for 5 days. So very simple, 5-5-5, easy to remember.
Next question, how much time had elapsed between Dawn's before and after photos? So she had 2 rounds of the Sculptra treatment. So you saw her before photos, treated her that day. She came back about 7 weeks later. We did another round of the Sculptra. And then I believe we waited about 2 months after that treatment to take the photos. So,
and she had what, 4 vials of Sculptra? Or
she had 4 vials,
okay.
Correct. Yes. Yep.
Would you do any fillers at the same time as Sculptra? Yes, I do. That's certainly something that we can do. Kind of just depending on each patient, again, what we're looking to address, if there's a lot of significant volume loss, or if a patient's looking to have maybe like a little bit of lip filler as well as Sculptra. Again, certainly based on the patient and what we're looking to address, but yes, something that we can do.
The next question, did your live models have any other treatments? Yes. So Dawn, she received the 4 vials of Sculptra, and then I believe it was 3 syringes of filler that was placed in the mid-face. I believe we did a little bit in the chin and jawline. She did also have some disc port as well. We really feel like having kind of a combination of the treatments to get that overall look that patients are, wanting to achieve. I think it's most ideal to have a combination of the treatments, which is why we performed that on her.
And Tracy did as well. She had 4 vials of Sculptra and gosh, I want to say maybe 3 syringes of filler to the jawline, some in the chin, and some disc port as well throughout her whole face. Kind of.
Well, the next question is, how expensive is this? So with our Sculptra vials, they're $850 per vial. With our filler, we charge $750 per syringe of filler. So with the special that we have going on with the buy 3 vials of Sculptra, receive 1 full syringe of Restylane filler, you would essentially have a savings of $750.
What is it? Can I still use filler while waiting for Sculptra to work? Absolutely, because Sculptra is great for just, rejuvenating. It's great for a nice glow to the skin, texture change. I mean, it's for so many different options. But again, as we have previously described, Sculptra in not being great for somebody who has a lot of volume loss. So it's great to restore some volume and then have that Sculptra in there too to help with regeneration.
Next question. It says, I'm not sure if Sculptra is right for me. Are there other same-day procedures for wrinkles and improving the jawline? Yes, so when you come in for your consultation, we can definitely assess and decide what would be an appropriate treatment for you. If you decide Sculptra is not something that you want to tap into just yet, then we have Dysport, any neuromodulators that's going to help to weaken and relax different muscles that can help kind of soften those expression lines. We have the filler options as well if we're looking for some instant kind of dramatic defining of the jawline or just getting a little bit of that lifting effect. There are multiple different areas that we can use filler for those. So it's definitely something that we can decide when you come in for your consultation.
Next question, is it possible to get Sculptra after a facelift? Absolutely. I tell all of my facelift patients, just because you've done that, while that's highly beneficial and great for skin laxity, you still need to do your toxins. Sculptra is great, and it's still not going to necessarily address a lot of volume loss. So I think honestly doing all of those things are still important and definitely something we can do.
Next question, will this work for jowls? Is a facelift the better option for jowls? It really depends on the severity, I guess you could say. I mean, as we age, we do start to lose a lot of the support that we have in what we call the preauricular space in through here. So when we're losing the collagen, elastin, extra support that we have here, that's when things can start to descend and we start to notice the jowl area. So with Sculptra, when we treat this area in through here, it can help to kind of give that support and improve the jowl area. But it depends on the severity of your jowls. If it's quite extreme, then most likely when you came in to have a consultation with us, we might refer you to one of the surgeons.
What about the neck region? Is Sculptra an option for the neck? Not really, not currently. I know people have been toying around with this, something that we're hopeful to maybe get into ourselves and train, but as of right now, it's not FDA approved for the neck region, no.
Next question, what happens if you don't do the 5-5-5? So 5-5-5, like Ashley was explaining, after your Sculptra injectable treatment, we want you to massage the areas for 5 minutes, 5 times a day for 5 days. It really is quite important for you to perform those treatments or that massaging. If you miss one of them, that's not a big deal. But the idea is that there's these little particles that we want to stay dispersed and we want it to integrate into the tissue appropriately. So doing that massaging is going to help keep those little particles dispersed, and it's going to generate the collagen that we want in an even fashion.
Next question. I've heard this is a big treatment people are getting now after using GLP-1s. Are they those who've lost weight having, okay, sorry, that was, yes, patients who are having significant weight loss, particularly using those injectables, have had great success using Sculptra post weight loss, yes.
Can Sculptra help with the under eye area? So this is an area that we do not treat with Sculptra. Any area where we have strong sphincters, so around the eye and around the mouth, with so much muscle contraction in those areas, we don't want those particles to get clumped up. So Sculptra in the eye area, we stay away from, as well as around the mouth.
Mm-hmm. Okay.
So I think that kind of wraps up the questions here. As a reminder, you will be receiving a text message, and please reply with the code word volume to be contacted for a consultation. Thank you so much for joining us. I hope you guys have a great rest of your night, and
Thank you,
hope to see you
guys.
soon.
See ya.